right, thank you so much. That was a great discussion today. I think a great talk to kick off our discussion today, I should say. And definitely HUD is certainly one of the key partners that we have in communities to make sure that our communities have all the options that people need and really to be able to thrive, as we discussed. So what I want to do today, though, is to take, before we start to get to our panels and that involved discussion, I want to actually tell you about this index that we're talking about today and tell you a little bit more about why these issues are important. So what I'll do now is start by just going to a little bit of background here. So first, by 2034, people over the age of 65 will outnumber people under 18 for the first time in US history. And that's a fundamental change point. When I came to AARP about 15 years ago, community leaders needed to be convinced that aging was an issue they needed to be paying attention to. Now they come to AARP looking for solutions because they know their community is aging. We've been building for centuries, thinking that we could build for younger families and that would cover most people. But the reality is hitting many that we actually need to pay attention to people of all ages, and that takes time to do. We can maybe change an ink pen or some other product overnight to make it better for aging. But a housing stock, a transportation system, that takes years to do. So we need, this is an urgent issue to make sure that we're paying attention to the aging population. Simultaneously, we know that most people, and nearly 80% of those 50 and older, and nearly 90% of those 65 and older, want to stay in their communities as they age. Communities are important to people. And I took a lot of economics classes in my day, and I always got frustrated because when it came to housing decisions, communities matter to people. Their favorite things are there, their memories are there, their religious institution, their favorite place to hang out, their friends. People are parts of communities, and so people want to stay in those communities. However, less than 1% of homes, according to a Harvard Joint Center study of the American Housing Survey, a nice HUD product, less than 1% of homes have the features that people need to age well. If you look across all of the features that people might need, less than 1% of homes have that. And to David's point about the importance of housing costs and housing affordability, 10 million households over 65 are housing cost burden. And we also mentioned COVID briefly, and over 165,000 people, according to the AARP nursing home dashboard, died in nursing homes during COVID. And I look at that, and that's a terrible tragedy in so many ways. But that's also 165,000 families who have seen that their loved one, their parent, their friend was in a situation that was obviously the worst case scenario. And the number one barrier to people from leaving nursing homes is not having housing that's affordable and accessible in that community that they can move into. So this is literally a matter of life and death to not have the right housing options that we need. And since COVID, we've seen so many more community leaders come to AARP, really thinking about, well, what can we do to house people? We see this crisis happening, what can we do about it? And frankly, many community members themselves thinking about, well, what can I do to make my housing better? What can I do to set myself up for aging that works for me? So this really sets the scene of what we have here in America. I mean, we have a future where it's unpredictable. You never know if you're going to end up like my father's friend and have a health incident that stops your business from growing, and frankly, a pandemic that might jump in there too. That might change your affordability calculation just like that. You may have something that changes. I've talked to many people who bought this dream house on a cul-de-sac that was nice and safe, but there are too many stairs. And now they can't get up and down the stairs, so they're limited. They can't drive anymore, so now they're isolated from many of the things in their neighborhood. So that dream home can become a nightmare. And what's really key, though, is the idea that if we have options, we can, and we think ahead about our housing, we can figure out the ways to better serve ourselves, even when we have that unpredictable future. So Shannon Guzman and our housing team put together this website here, our aarp.org/future of housing website, that talks about how all of the many trends that are out there are looking at and impacting housing. So whether it's advances in technology, affordability we've mentioned, the demographics, the fact that decisions are made at local government levels, the fact that our changing climate and our environmental conditions and natural disasters, as was mentioned earlier, are impacting us all. We're just not building enough housing in this country, and not enough of the housing of the types I've mentioned that impact all of us. And there are barriers systemically. Some of us are finding housing discrimination in various forms that limit the housing we can get to. So there's lots of housing challenges in this country, and we want to be in the position of helping to address some of those challenges. And that we should not just be AARP, it should really be all of us. So this, and I'm looking at the Dean of the University of Maryland School of Architecture in the back, comes from the dissertation work that I did back in years ago there, where this really is a foundation, a conceptual framework that's at the foundation of our index and our work on communities. And the idea is that we all have preferences. They may be of a home that's the right price and the right neighborhood for us. It may be the pretty home, it may be near family members or things you want. And so we all have a varied range of preferences. But those preferences can change over time. Once you stop driving or become a caregiver, or once your spouse may pass on, your needs may change. And so our preferences are varied and they change over time. And then for some of us, we have specific preferences or things we need nearby us. We may want to be a religious institution or a place where we can feel integrated politically. So we all have those things that help shape where we want to be. However, there's limitations that if we can't afford a home in that place we want, might as well not exist. Sometimes there's, those homes aren't available. They just don't exist in that community. There may not be a home near a park or a library and the like there. There's all kinds of issues that can limit us from getting there. And so the idea of what we're doing is we're trying to address as many of those limitations as possible so that people's home and community locations can closely match their preferences. Right? So if you can find the home that works for your current self and your future self, that's the ideal thing for you. But to do that, we have to reduce as many barriers as possible. And that's at the heart of what we're trying to do with the index and many of the work that AARP does. So to do that, I look at 3 different elements of change. The idea, and we've had HUD here to think about what we can do at the federal level policy-wise. There's also state and local policy. We need to make changes on the ground, policy changes to allow the kinds of housing options we need, to create the kinds of transportation options that people need, and the other things that they want in their communities. We also need industry to produce the kinds of things that will serve us as we're aging. If we can't find it in the market, it's not there. And we as individuals have a role in this to play as well. So we need to think about our future selves. How might our conditions change? How might our families change? How might our lives change? And if we think ahead, we can also work to make our communities and our homes better. And so the idea is all 3 of these legs have to work together to make that happen, to make the community change I'm talking about happen. And we have to all ask ourselves this question, that are we building communities with livability in mind? And the Deputy Secretary talked about it, David talked about it as well, so I won't get too deep in the fact that we just need to have the communities with the choices and options that people need. And at AARP, we have an entire livable communities portfolio that looks at creating communities for people no matter their age, no matter their income, no matter their physical ability. We need to create communities that have these things. And that's really at the heart of what we do. You see access to health care there. You see a walkable community, someone with public transportation, parks, et cetera. We need to have more communities with more of these options. So that brings us to the star of today's show, which is AARP's Livability Index. Now, this is the part of the show where I tell you I don't actually mind if you pull out your device or your computer and you go to aarp.org/livabilityindex on your own, because we have updated the index just today so that all of you can see our latest 2023 scores. Now, we invented this index back in 2015 as the world's first nationwide neighborhood-based livability index. What that means is it was the first of its kind to look across the country at every neighborhood and provide scores across 7 different categories, which I'll talk about in a second here. But first, what I want to do is to introduce you quickly to our team here, our core team. I want to make sure that you know that I'm not just the only face behind this index. You see Shannon, Jana, and Suleiman there on the screen that are very important to the work that we do and all of their roles. as well as Ari Hauser, Tim, Berna, and Srader, part of our AARP Public Policy Institute team. I see Sabora from our research team in the room. We've got our digital services team. I see our team at Forum One that helped us design the index, and many others as well. There's a large family of people that come to make this index work, and I want to make sure we recognize all of them, and I thank them for all the great work that they've done. And as well as we've got a technical advisory committee. And I won't read all the names, but this is the third or fourth iteration of our technical advisory committee. We've got some emeritus technical advisory committee members somewhere in the room here that we were saying hello to earlier. But we've took experts across the country to help us figure out how to do this, how to create an index that works and does all the things that we're talking about today. And I want to thank all of them as well. So by now, you should have had time to pull out your device and go to the website and look up your score. So I'll tell you what you're looking at. So first, I mentioned 7 categories. So there's housing affordability, there's housing options, there's housing with housing accessibility, housing options, and affordable housing. We can look up those things in that housing category. Our neighborhood category talks about the things nearby that people want to be near: parks, libraries, grocery stores, other things that are important to have in a neighborhood. We've got transportation options, whether they're public transportation, how safe it is out there on the roads, and excuse me, and even how much traffic there is, because all of the different ways to get around matter to folks. Air and water quality is super important in the environmental category. We look at health, access to healthcare, quality of healthcare, some of those other things there. Social engagement, whether people in the community are connected to one another, whether they have the internet access to do that digitally, is important there. And we look at opportunity as well, things like whether people in that community have economic opportunity, whether the school quality is the way it should be so that people can advance, what the local creditworthiness of the community is, and many other things. And so across each of these 7 categories, we look at some metrics to look at things on the ground, and we look at some of the policies that could be put into place, and we track those things. We try to encourage communities to make policy change so that they can improve livability, but we also want to make sure we show everybody, from your neighbor to your community leader, what's going on in your community. So up here, you'll see what the score is for DC. It's 57 on a scale of 1 to 100. Right? No community is perfect. Every community has something to improve. And so here you see that DC is on the upper side of that scale, and you can see where they measure compared to other communities. And when you look at your score, you can see your score, not just for your community, but if you type in address, you go all the way down to the neighborhood level, technically known as the census block group. So really excited about our ability to have new scores on all that data. But the thing I'm most excited about is the biggest change we've had in 8 years of the index. And that's that we've been able to take all of the data that we create with the Livability Index, and we tell you lots of things about your community, and we've been telling community leaders about their communities and things they can do to improve. Well, now we have the ability to use that data to help you search for communities, to explore communities. Maybe you need to move. Maybe you're thinking about what community might serve you in your future. Maybe you want to just explore other communities nearby that are competitor communities to your hometown, and you want to know information on them. So on that home page of the index, you can now go in and you can select a button that allows you to search communities by all of the categories that we talk about, the many metrics in the index, and more. So that's very exciting to be able to use that. And we have a community finder quiz that for those that aren't inclined to dive through a whole bunch of data, just answer a few questions. I know not everybody wants to do as much data as we do, but just answer a few questions, and then you can go through and find out what communities work for you as well. So that's very exciting for us. But the headline story for today is to talk about the top performing communities in the country. So we're going to talk about our Livability Index Top 100 today, which we're really excited to unveil. So these are the communities that score highest amongst all the communities in the country. We score every place again. And you can see from this map here that they're spread all over the country. We've got communities large, small, and everywhere in between. Now, one thing we've done this year is that we've expanded this list. The former list was the top cities list. But what we realized is that we're eliminating a lot of places when we do that. And most people do give you top cities lists. That's easy to do, relatively speaking. But since we have all this data in the index, we can actually do communities of any type, of any size. A county, a city, a township, and everywhere in between. So our top list here now include all types of communities. And you can see here the list for the top performing large communities and very large communities. You'll see communities like San Francisco up at the top of our very large communities, and you'll see communities such as Madison, Wisconsin at the large communities, and 24 other compatriots. These large communities often have great access to transportation. They have neighborhood access, things you can walk to. They have many of the things that communities need to have livability options throughout their community. So we're really excited about those. These communities also are typically safe on their streets and often have high health scores as well. So these are communities that really have a lot of things going, but some of them have very strong affordability challenges. Out of our communities, only I think 5 out of the top 100 have the housing category as one of their drivers, meaning that the housing was a kind of an anchor on many of these communities instead of a bonus. That housing affordability is very challenging in these communities, and we have a great panel coming up to discuss some of the housing affordability challenges in the country later on. But there's benefits, there's challenges. That's the story for every community that's out there. And on our mid-size list, you'll see communities here as well that have scored. You'll see Aspen, Colorado there, and on the small communities. And you will see Portland, Maine on the top performing mid-size communities list, and their compatriots as well. So these are the list of the smaller communities where people may want to be that don't enjoy big city living. And you'll see engagement as a primary driver for these communities. And some of our top scoring small communities have a perfect score in engagement because they have things like broadband internet access, opportunity for civic involvement, high voting rates, and actual people volunteering and taking part in their communities. So we've got a list of 50 communities in these two size categories as well. So as you're looking at these communities, I do want you to note, by the way, that our top scoring communities only have scores at about that 60, high 60s range. And when you think about all the things I was talking about, all the trade-offs that communities have, can you have housing that's affordable and access to parks and grocery stores and high civic involvement and everybody's voting? That magic place doesn't really exist. I hate to burst your bubble if you're planning to move there, but I'm not going to tell you that place exists. But what does exist are places that have some of those benefits. Every community has something that they can stake their claim on as something that helps their community thrive, helps citizens in that community thrive, residents in that community thrive. And every community has challenges, things that they can improve. And so that's a lot of what we're going to talk about today. So at AARP, I mentioned that we've been working on communities since our founding. And since we founded the Livability Index back in 2015, we've seen so much growth here. I want to just toss out one example of this. And this example is of our age-friendly communities program. And one of our panelists here is representing age-friendly community. You'll hear more from her about what those are. But this is an effort to improve communities across many categories of livability, of age-friendliness, of things that work. Now, when I first came to AARP and we started the network, there were only a handful of communities. I think it was 12 or 16 or so were there back in 2008 or so when I started. By 2015, when we did our first index, there were 429 communities that had taken the commitment, the 5-year commitment that it takes to work on issues to become an age-friendly community. And today in our index, we reflect over 750 communities that have made that change. And since we've had to finalize and lock in data for the Livability Index, we've had another 40-plus communities join that network. So it keeps growing, and that, to me, is part of the inspiration. Right? The communities are not just sticking where they are, that they're actually working to improve on these things. So maybe we can get some of those scores in the 60s way up there where they could be in a higher range. And frankly, any community can benefit from being an age-friendly community and taking advantage of the opportunities that are there to make themselves better. AARP has 53 state offices. Nearly all of them are working on livable communities issues. I've been told there are nearly 1,000 projects that are going on in various ways, shapes and forms in different communities that AARP is part of, and that is frankly inspiring to me. And I know there's thousands and thousands more that aren't being done by AARP, and that's great too. We're only one piece of the puzzle that we want to encourage not just you, but everyone to work on making their community more livable. And so I want to give one plug for our aarp.org/livable homepage. For all of you that see yourselves as community leaders, once you're done playing with the index, go to aarp.org/livable. You'll see things like our home fit guide, all of our work on accessory dwelling units. You'll see where we live, where we talk to city leaders about change. Lots of great work from our Public Policy Institute on the policies and solutions that communities can have. Just a wealth of resources that I couldn't talk about today are right there on that website at your fingertips. Because we want to enable anyone who comes in to do some of the things that help make communities better. At AARP, we used to talk a lot about being everyday innovators in aging. And I take this challenge very seriously, that every day I try to do something that helps make people's lives better. And this index being an iterative product that we created in 2015, and we're able today to talk about and show you the new index and everything that's in it, is an example of our innovation. But I challenge all of you to be everyday innovators as well. What can we do what can you do in your roles? Can we implement a new policy that might help make our community better? Can we take a resource and share it with others that may help them make a housing choice that helps them better off in life? Maybe make a transportation choice that helps to save the environment or to prevent traffic from downtown. What can we do to help make our lives and the lives of others better? And the first thing we can do is to start taking an approach of livable communities, of thinking about people of all ages, of thinking about people of all ability levels and all incomes and everything we do. Think about how we can make things work for those folks. And for ourselves, it's okay to be selfish sometimes. For ourselves, think about your future self. What does that person need? What might change in my life that might benefit me as I'm getting older? And if you make decisions that way, you'll not only help yourself and be in a better position as you're aging, but you might help your community as well. So that's the story of livability, and I challenge all of you to be everyday innovators as well. So that's a lot of talk from me. So what I want to do is to pause for a second and introduce our first panel. This panel is going to help me to talk about livability and talk about how it impacts the work that they do. And frankly, these are three great folks I couldn't be more excited to have here. First, I want to introduce Angela Brooks, who's the president of the American Planning Association, of which I'm a proud member. Angela's joining us all the way from Chicago, and I'm very happy to have you here, so thank you, Angela. All right. Our second person here is Stuart Swartz. Stuart is the leader of the Coalition for Smarter Growth here in the Washington, D.C. area, and focuses on livability in this region, so thank you, Stuart. And our third panelist is joining us all the way from Pittsburgh and hopefully not going to miss too much trick-or-treating tonight. So I want to thank you for coming down here. I want to introduce Laura Poskin, Executive Director of Age Friendly Greater Pittsburgh. So thank you, Laura, for joining us today. All right. So thank you all panelists for coming here. I'm really excited to have you here, and I think Angela's got a nationwide purview with the work that she does, but also working as a local planner in Chicago too. So we've got two levels, and we've got two folks that are working at regional levels to improve livability in their communities. So I think this is a great panel to really talk to you about the livability concepts we're talking about and really make it real. So first, Angela, when I released with Deb and Deb Whitman was in the audience here from AARP as well. We released the index at the first time in the APA conference in Seattle years ago. I called the index the planner's best friend. The idea that they have a tool that they could take with them to do their work. What kind of help do planners need in making livability changes, and can planners use this kind of tool in what they are doing?
Yeah, absolutely. I mean, I think first, planners use data. I mean, it's kind of what we need to back up all of our decisions. I put in my zip code earlier. I'm a little bit hurt. Clearly, I do more work at work than I do in my own community. So when I get back to Chicago, I'm going to go to my alderman's meetings. We got to move that index number. But seriously, I do think a lot of the information, and it's just very helpful to see the data behind what we think we know based on theory. It gives us the data to back up the things we know, and it also shows areas that, like my neighborhood, which has been historically disinvested, it demonstrates the lack of investment and what is needed to really move the needle and create the types of communities all of our residents deserve to live in. One of the things that our trend report has shown is, one of the act now things is making communities available for people who are aging in place. I'm at the point in my life where I'm dealing with that on my parents' side. So I think a lot about livability for my elders from my parents' side. And you have me thinking a lot about my future self as I climb 4 flights of stairs to get home every single day. So, those are the types of things I think all of us can use, not only in our professional life as planners, but as residents of our communities as well.
And, you mentioned some of the challenges that different neighborhoods are having. And one of the things we're able to do is to, with the index, to measure what's going on in the east side of town versus the west side of town, or north side and south side, or any other community division that you think of. So, thinking about equity specifically of people in different neighborhoods, is that something that you think is a focus or should be a focus for improvement in communities?
Absolutely. So what isn't included in my bio is I also sit on the Chicago Zoning Board of Appeals. And so when I start thinking about that, I've had to learn about the 3,000 different neighborhoods in Chicago, and they are all really different. And being able to pull data from them quickly is really important, because there's no way you're ever going to know intimately every detail of every neighborhood. Equity should be the lens that all planners and really all professionals should be looking at, just because the historic disinvestment that have created 2 and 3 different types of tiers of cities, to really look at how do we move the needle, but also where should we be doing the investments. I'm a cyclist, so I definitely notice the difference between cycling on the south side of Chicago and cycling on the north side, or even some of the suburbs. It's just making it user-friendly for all is a lens I think we should think about, as well as looking at, in Chicago right now, we have the Invest Southwest, which is looking at reinvesting in communities that haven't been invested in decades. And a lot of the information that we used to pick the neighborhoods that they chose were basically similar features to the Livability Index.
One of the things that I found over the years is we show mayors this data, particularly mayors in smaller towns that don't have access to planning departments. And their eyes are open to know that, oh my gosh, we have a lot of grocery stores, but they're all concentrated on this part of the town. And we never thought about the folks over there that don't have the grocery store access or some of the other issues.
I do this for a living, and I live in a food desert, and I didn't think about it until it directly impacted me, because I've always had a car. So the year and a half I didn't have a car, and this is what I do for a living. I went to the bodega down the street, and I was like, oh my God, the eggs are double the price. So I mean, it is helpful to have something to back up stuff you just don't think about. It's out of sight, out of mind, and you have great intentions, but it is nice to have the backup. And I think a lot of times people think things are urban issues when they are suburban and rural, as you pointed out. And I think those are the types of folks that really need this and can utilize it.
Yeah, thank you. Well said. Now, before I go to our local panelist, I want to make sure I remind the audience that we will be taking questions after this discussion. And so please write any questions on provided cards on the table. Someone will be around to collect those cards later. But I do want to really stick with the local level, but talk about Allegheny County. Now, Allegheny County's score was 25 amongst very large communities, so good for Allegheny County. Pittsburgh, by the way, was 30, just missing the list out there on large communities. But Laura, you've been working for age-friendly Greater Pittsburgh for a long time there. And so could you tell us a little bit about the work you're doing and the kinds of great things going on in the community and the kinds of things you're working to help improve in your community?
Absolutely. Well, thank you for inviting me to this wonderful event. We're so happy to be part of the network of age-friendly communities led by AARP. Yeah, I saw the 750 number and I was like, I think it's 797 now.
It is,
It's
right.
growing all the time. And we've been a part of the network for 8 years now, which really means that we're dedicated to making our region more inclusive and respectful of all ages. So if we're thinking about a sidewalk, if it's gonna be good for someone who's 86, maybe using a walker, it's going to be great for a kid who has a giant backpack, who's 6 years old and looking around, not paying attention to where they're going. It's going to be good for a 40-year-old mom like me who's out pushing my wagon with my 2 kids. Thank you. I do want to get back for trick or treat. And so we're a coalition of 120 organizations. Some of them work in aging, but not all. You know, and where we live, we're almost 20% of our population is already in that 65 and older category. So I like to tell everybody, guess what? You work in aging. Because if you're working with people, if you're working with families, you're working in aging. And improvements that help our older residents are gonna actually help everyone. So yes, thinking about our future selves, but like you said, like you're a cyclist, like thinking about your current self and how does this environment work for you. Some of the things that we're working on, and this is really informed by the data. I'm so happy that we're at the top of the list, and I was looking at the Livability Index this morning. We score really well on transportation, for example, which is great. But we know that our community is not livable for everyone. You know, we make a lot of the top lists of places to retire, or the top, we're 25 on this Livability Index, but we have to ask, who is that for? We know that older women, white women in our region can expect to live to 78, while Black men can expect to live to 64. That's a difference of more than a decade. And I know that that's not a unique issue in Pittsburgh, but we're hyper-focused on it. We're working at the neighborhood level, and we select the neighborhoods with a really robust selection process where we're choosing neighborhoods that are overburdened and under-resourced. So we're not going to the neighborhoods that are maybe scoring in the high 60s on the Livability Index. We're going to places that are primed to work, and also we're making sure that we look at all the assets. I mean, maybe they don't score high on the Livability Index, but certainly they have a lot of community assets. So we're working with them, investing in them, and helping residents decide what they want to work on to be able to live there as long as possible.
Yeah, that's great work, and it's so important for all the people in the community. And you mentioned transportation a little bit, but we talked a lot about housing today. We're at National Housing Conference is here, so I have to ask you a housing question. Okay. And how do you reconcile growth management in Pittsburgh with housing affordability?
It's a great question. We're always thinking about, and you said this earlier, we're always thinking about options. There need to be options everywhere. We also are thinking about density. We know that people want to live in communities, everybody, whether you're older or younger, want to live places where you can walk, where you can age in place, but we always talk about aging in community, right? Like you don't want to age in your living room, watching TV in your lazy boy. You want to be part of the community that you call home. Like that's why you want to age in place and live there. So we're always thinking about options, thinking about affordability, and when you have like middle housing, when you have all sorts of options, when you have ADUs, we're working on that in Pittsburgh. When you have all different options, when you have affordability, when you have accessibility. And accessibility often, and I just did it, I put it last, but we've got to be thinking about this if we want to develop communities where we can live for our whole life. And I think the Livability Index is amazing for planners, for people who are considering to go different places, but also a lot of people are planning to stay in their communities and maybe not go to another community, but they can think about like what can we be working on, and housing is so infused with all the other aspects, right? Because you want it to be a part of the community. So you can think about all the different factors that you have there in the index, and but yeah, options, affordability, accessibility.
All important things. And you raise an important point about the interconnection between all the issues that communities are facing. We have 7 categories in the index, as I went through. Part of the story is that those are all interconnected. I know the Age-Friendly Network works across 8 domains, but no matter how we're thinking about it or framing it, the idea is that we shouldn't work on any of these issues in isolation. I think that's pretty much what I'm taking away from your words, which I think is a great point.
And I'm moderating a panel of builders, actually, which would be really interesting. It's not my expertise, but I'm getting ready to ask them about, how are you thinking about the communities that you're developing as communities and not as siloed places where people are gonna, just be able to be in place, but really age in community.
I think that's an important conversation for them here. I mentioned industry earlier. I mean, the other thing is they've been, to my demographic slide, that's one of those industries that's been doing things the old way for a long time. They've been doing the things that they've been doing it, and it's worked. It's made money for folks. But what about that future? We're talking about that aging future, that more diversified future. Are they building the things that people need for that as well? So I'm glad that they'll have you to whip them into shape. And one more reminder for folks in the room and on the screen is that I'm going to talk about all the communities in a second that's in Stewart's region that are scoring well. But you can see all of the top 25 lists. If you're on the website, you can scroll down and just look at any of the communities listed are there, as well as your own community score. But Stewart, we've got 6 communities across the DC region that are top performing communities. We've got Montgomery County as a number 10, very large community. Fairfax was County in Virginia, 14. Arlington County in Virginia, also number 5 in large community. Alexandria was number 12. Falls Church, Virginia, number 8. Tacoma Park, number 16. So lots of different places in this community that are doing well. But I also know this community is one of the most expensive regions in the country, I should say. This region is. So we've got lots of high-performing places, but are there challenges you see across the region as well?
Well, we're a fortunate region overall, and we ranked very well. We're very proud to have those rankings. I'm sure the local elected officials will be as well when they see it. But I started digging into your numbers, and first of all, thank you and AARP and National Housing Trust, and thank you for Rodney and your team for giving us the unifying index for everything. It's going to be a very helpful tool for us. As I dug into your numbers and looked at it, not surprisingly, despite the high rankings of those 6 jurisdictions, it was housing where we did the poorest, just about across the board. And we have long recognized that we have a housing affordability issue here. We're not building enough housing. We don't have enough funding, even despite all the good work of advocates in our housing trust funds. But the region is committed to tackling it. The Council of Governments has committed to adding, like 100,000 more housing units to what's projected, but also aiming to have 75% of those affordable, aiming to have 75% of those located next to high-capacity transit. And, that's a place where we've been very successful with our metro system, our bus system. We do rank very well in transportation according to the index, and that, that's reflected in the transportation system we have. We've committed to, my organization first started promoting this in the 90s. I stood on the shoulders of others who talked about a network of walkable, transit-oriented communities. And we need to make those more inclusive because they're in high demand. And we still have many places where we can build them. The other place the index showed some challenges for this region, interesting, were environment. And I noticed you included in that pollution near highways in particular. That has become a looming issue that has long been ignored, how dangerous our highways can be to our health. Often there's a disproportionate effect on lower income communities and people of color, but I think we're seeing it, just anywhere if you live near a highway or a large arterial, you're faced with more pollution. And that's going to be an issue we're all going to have to deal with. Even better argument there for walkable communities, an additional argument for walkable communities. The other place, in a way, somewhat related to the housing was your opportunity measure. And a lot of it, I think, probably reflects the inequality in that measure that you measure. We see that as well. The other things I do notice by looking at the jurisdictions in our region that were not in the list is that our east-west economic and racial divide can show up when you start comparing the jurisdictions. I think Chicago has is it north-south? And we've been trying to tackle that since the Brookings report in 1999 called A Region Divided, and we have much more to do there. And then we see in the outer suburbs, housing isn't necessarily that much more affordable, but their transportation performance is terrible because of long commutes and lack of access to jobs in places like that. So those are some of the things I was able to pull out of your index.
Yeah, that's a lot of great insights there. And one of the things that was crucially important to some of the last things you were saying for us when we built this thing out was we wanted to be able to show people these things as well. So I didn't show any of the maps on the presentation there, but you can actually visualize and see the air pollution or some of the other issues in a community. And then you can look at where the racial groups are, where the age groups are in the community as well, because we're seeing some of these differences. And numbers on a paper sometimes don't tell you the reality that people are facing on the ground. You kind of have to see it visually to make that happen. So we've talked a lot about what the index shows for the community. I think it was very helpful. But could you talk a little bit just more about the issues? I'm a champion of the Coalition for Smarter Growth and the work that you're doing. So the issues that you're tackling to try to improve, create more livability in the region?
Well, just about every issue, not quite every issue that you've touched, but housing has been a key one, and we've got great partners. Michelle Crocker, the founder of the Northern Virginia Affordable Housing Alliance, who recently stepped from that position. She has just been an amazing partner in building the housing coalition, but we've worked with groups like that, and DC. We have a DC Housing Advocacy Coalition. We have the Montgomery Housing Alliance that we all work with. So it's more funding for affordable housing is absolutely critical. DC's done wonderfully in that, and the other jurisdictions have had to play catch up. I have to say, one of the points I always like to make is this, and we had the secretary here. I'd like to give her a big transfer from the federal highway program to our federal housing programs, because we spend an awful lot of money in expanding highways and promoting sprawling development, and not enough money, not just on transit, but on housing. And then, so that's a big pitch we're making in this region. Let's start more investing in housing in the right locations, convenient locations. That will address transportation problems, not to mention giving people a roof over their head and addressing many other issues. We're very active in promoting walkable, transit-oriented communities. We have supported inclusionary zoning in all the jurisdictions where a certain percentage of the units have to be affordable. We endorse plans and projects at transit stations and walkable communities. We're right now in a huge fight to save Metro. The big transit agencies across the country have been hit very hard by the pandemic and telecommuting and inflation and so forth. We have a $750 million shortfall in 2025 fiscal year and beyond. And it's been pulling teeth to get many elected officials and other leaders to see how dangerous this is. I think we're crossing the threshold where their action is going to happen. But again, we need to be investing more in that. It's such a key, transit is such a key factor for access to jobs and opportunity.
So one of the things inherent in the work that you do, the name of your organization is a coalition, and building partnerships as part of that. So I want to start kind of the group part of the conversation by thinking about the partnerships that are needed in communities to make the kinds of changes we're talking about. So I'll give you a break for a second. Start with Angela to think about what kind of partnerships are needed. How do we actually create the kind of change we're talking about here?
Oh, when your name starts with A, you're always first. Just can't win. No, I'll talk about a lot of the work APA is doing, because that's one of the big things that we recognize as planners, that collaboration is key, because at the end of the day, we are theorists, we write things, but elected leaders do them. And so I'll do my plug for the Housing Supply Accelerator that APA is partnering with the National League of Cities. It's a partnership between APA and NLC to look at how do we expand housing supply. You talked about it a lot. We need to increase more housing units. We are underproduced year after year, and it's only getting worse, even in rural areas. So for the last year, we've been convening with elected leaders, but we've also had other partners in the room. We've had financial institutions, we've had the builders in the room as well. And it's just great to have everybody in the room talking about these are the things that are keeping us from including the types of housing choices we need in our communities. We've talked about zoning reform, which is one of APA's biggest policy issues right now, which is always really comfortable to talk about as a zoning board commissioner. We talked a lot about finance. I'm a former affordable housing developer, and my actual job, CSH, we are also a CDFI, so we're a lender, and we're looking at affordable unit per unit costs over $600,000. So we know that's an impediment to increasing more units. And then we've also been talking about, the supply chain. It's really expensive and really slow to get materials right now. So like, how do we speed that up? But not any one of these organizations can get anything done by ourselves. So it's really important for us to be in the room to really talk about how do we get out of the way and how do we support each other in doing so.
Yeah, some great work with APA to really branch out to other organizations that have similar work. And I was worried about the player alone in a room trying to say that something's good for the community. I really need folks in there. And, Laura, you can't have an age-friendly community effort without partners, right? So how does that work for the work that you do?
Sure. So I mentioned that we're a coalition of 120 partners, some of them working in aging, some of them not, actually all of them working in aging. And some of them are involved in our work group. So we have a transportation work group, a housing work group, a digital access work group, a dementia-friendly work group, and a workforce work group. So we have 5 amazing work groups. They decide what kind of projects they want to work on. So, for example, our transportation work group early on realized that the accessible seats on all of our buses in the area were not called out. Like you went on the bus and you didn't know where the accessible seating was. And so since 2017, all buses in Allegheny County have bright yellow seats with the accessible sign on them, just to call out like this is the area for accessible seating. Again, better for older adults, but really better for everyone who is taking the bus. So we have our work group partners, different co-chairs that are doing, so our main co-chairs for the transportation work group are a paratransit service. Again, invested in older adults, but really invested in people with disabilities and all ages. And then our health department. So we have a really broad group in this coalition, but I would say our biggest partners are the residents right now, and so, or all the time. Mr. Rogers was from Pittsburgh, so we were talking about Halloween costumes this morning with my team over Zoom, and one of our team members was like, "I'm gonna be Mr. Rogers." Like, that's such a Pittsburgh costume. And so, we're really focused on our experts or our residents as the experts. And so when we're in the age-friendly neighborhoods, we have ambassadors that we pay for their time. They're not just volunteering their time. And we also give them a stipend and say, please spend this. And this year it's $20,000 in each of the neighborhoods. And they get to decide how they're gonna do that. So one of our groups is more of a suburban area. I mentioned that transportation ranks really high for us in Allegheny County. Not everywhere, that parts of the county that are more rural and suburban don't have great transportation. And so there's a group there, residents who are the experts, who decided that they needed a kind of shuttle service to get to the grocery stores. And so every other week for the past, I should know this, but for the past 6 months, every other week there is a shopping trip on the paratransit service that is taking residents. And it was not us coming into the community and saying, "Oh, I'm a gerontologist, I know exactly what you need," or "I've looked at this score and I know exactly what you need." It's the residents who are deciding, this doesn't work for me, we have to have a new solution. And so when I think about partners, really, it is the residents who are leading.
Interesting, you have partners at all levels. That will make good neighbors that way, I suppose.
Yeah.
Stuart, so you know, you've got a time to catch your breath now. So I want to ask you about the partners, especially thinking about a coalition that's going across our region here. You know, who are the big partners that help to get your work moving forward?
Well, we do have coalition in our name. We were founded actually by conservation groups in the late 90s who really wanted to address where and how our region would grow. But our partnerships, our coalitions and partnerships are just this web, this matrix of things. So it's everything from what I've just talked about with our partnerships with affordable housing, nonprofit and for-profit affordable housing providers, to coalitions of coalitions where we put our conservationists in Fairfax County, Virginia, together with housing advocates and transit advocates and bike ped advocates and the NAACP chapter there. So it's that, and we created a joint platform. So, you know, often, you know, conservationist housing advocates could fight over the same piece of land, for example, of whether it's a conservation parcel or more housing. We've managed to find ways to get to the win-win-win across that coalition. We work with the business community, very much with the developers who do great mixed-use, walkable, transit-oriented development, and we push them. You know, they don't always like, some of them don't like inclusionary zoning, others are very supportive of it, but we work with them on, you know, make comments on their projects and recommendations, and so that's been a good partnership. I like some of our community partnerships, like in Ward 3, the wealthiest ward in DC, which, in fact, there was just a report out just today, I just noticed, about how the city's doing in affordable housing in each of the wards. The mayor wanted 15% of the housing in each ward to be affordable. They have been doing the least. Yet this is a group of people, many of them retired, some of them still working, wealthier professionals who are saying, yes, in my backyard. Yes, we want more housing in Ward 3. I mean, for years there have been so many objectors that they were called, the Upper Wisconsin residents were called the Wisconsin Badgers because they were badgering back every development project. But Ward 3 Vision is an alternative to that, as is Cleveland Park Smart Growth in that area. We have Rise Prince George's in Prince George's, Livable Alexandria, Montgomery for All, each of these groups. Now, we are very small, so we're not great on the grassroots other than sort of digital advocacy, but we'll partner and have had great partnerships with Action in Montgomery, which does great grassroots outreach, and we hired one of their people, joined us to be our Montgomery advocacy manager, and they helped us do all of the outreach on the Thrive 2050 new general plan for Montgomery, which made housing a big part of that sustainability plan for the future. And then the last example I'll give is our partnership with CASA, the region's largest immigrant advocacy group, where we had a very discrete project, Safe Streets for Bailey's Crossroads, Safe Streets for the Colmore neighborhood. It was a bilingual campaign. They did a lot of the organizing. We did a lot of the policy and the walk audit coordination and that sort of thing, and we're together pushing the county and Virginia Department of Transportation to make that road safer. We just did a lighting audit the other day. One of the things that bubbled up was that particularly the women in the community were very upset about the lack of safe lighting for night, coming home late from work and so forth. So those have been just terrific partnerships with grassroots groups.
So clearly partnerships are important to all the work that you all do and your groups do. I'm curious about whether or not it's easy to sustain those partnerships over time. Once you have these folks in, are they in, or is it a process of trying to bring in new partners, replace partners that are leaving? How does that go in terms of really trying to create the long-term change that you've got? Anyone can jump in on this. If not, I'll call on somebody.
Have good focus. I mean, you know, I don't think partnerships are just for the sake of partnerships are good. Just like they say with boards and stuff, don't just have committees for the sake of committees. Have something to do. Have very clear, work together to identify very clear goals and a step-by-step set of strategies and keep that focus. And as long as you're focused on achieving certain goals and not trying to do too much or just to get together to talk, I think you can make these partnerships continue to be valuable.
Laura, did you want to jump in there?
Yeah, we've had a lot of longtime partners, people who have been with us since the very beginning, so for about 8 years, but we just always have a really open door, open invitation to be part of what we're doing. And I think the network of age-friendly communities kind of has that mindset. We always say, like, we have an action plan that was developed in partnership with residents and organizations, those 120 organizations. we say it's open source. We did the best we could to put the data that we thought was really important, and the stories and the photos, and please think of this as your document. It's our document. It's all, the whole county is part of it. And so, yeah, I think it's our job to also kind of be the megaphone for our partners of the good work that's happening. We work really closely with our area agency on aging, but that's not their mission to promote and change the narrative in aging. That's what we do. And so promoting all the things that go on in the community, and that might be from a longtime partner who is so happy that we're sharing their 50th anniversary, whatever it is, or it's from a brand new organization or community member, and it's something very small that's going on. And so I think that, there are different ways to include organizations or people in the work that we do, and we just try to always feed them well when they come to our events, and and just let them know that it's an open door.
And I think from the APA side, I mean, we're planners, so you shouldn't be shocked. But we have a strategic plan, and so one of the greatest things about our strategic plan is it really outlines our priority areas and what we'll work to, so it doesn't matter if I'm president or the next person's president. We know what we're working on. And we look at those organizations that are also working on those. So obviously, housing is a big issue, so is zoning reform. I think pretty much everybody's saying zoning right now. It's kind of uncomfortable as often as we hear it, so there's a lot of opportunity there, but so is climate. And so our partnerships really will depend on the subject matter and who the experts are in the room and how we can work together and move the needle.
So Angela, you bring up an interesting thing too about the issues at play. So as partners, but one of the things that we've hinted at is the interconnected issues that are out there. For me, one of my big frustrations has been siloing, that I always feel that we're too siloed. We have, whether it's government programs in a group that's working on housing or transportation separately or health separately, or whether it's organizations that are working on one of those issues with all of their different acronyms and language and the like. So when we're thinking about all of the different issues that there are, how do we deal with the competing priorities and cut through and think about the connections, and how do we get through that noise to try to make sure we're getting the solutions that go across and focus at the same time on the issues that are needed?
I think the key word there is prioritization. I think from a neighborhood planner, which is more of my background, I think about the neighborhood work I've done and the coalitions we've worked on is just setting the priorities that make the most sense. And, everything doesn't always make sense for a long time. So it's partnering when it does make sense and collaborating when it doesn't, but then still working together. There are organizations I've worked with professionally that we are opposed on a lot of issues, but there are some key issues that we work together. But on the issues we're not in alignment with, we still do work together to see if there's a middle ground, to work with particularly when I was a real estate developer on really looking at, these are the things that meet in the middle, these are the things that aren't, but on the things we can slightly agree with, how do we partner together to get these things done? I think as we all look at our work in building livable communities, there's going to be a lot of times, I mentioned I'm a cyclist, but I also have a car. So there are some times where some of the things that some of the bike organizations I am actively engaged in aren't thinking about the things that I think of in terms of safety, for instance. And so while we might be in alignment, like I'm never going to argue about a bike lane, but I certainly need you to understand that 7 or 8 o'clock, I might be worried about a drive-by shooting in my neighborhood. Those are the types of things that sometimes people don't have I'll say luxury. They don't have the luxury of thinking about in their neighborhood, but I certainly do in mine. And so I think that's a prime example of when we're working with organizations, and you really talked about really including people with lived experience in the work that we do, and I think often on the policy side, we don't do that. And so incorporating those with lived experience in those spaces really help, for me, set up my priorities on who I work with in my paid job. I always have to distinguish which hat I'm speaking from.
Well, thank both sides for coming tonight. I appreciate it. So Laura, is prioritization straightforward? I assume not, because you've got such complex regions you're working on, but maybe I'm wrong. I don't know.
I think that our action plan is a really centering document, but we have to know that that is a living document. Things change. When we've gone into communities, the 3 communities we're in right now, Clareton, Coraopolis, and the Hill District. In Clareton and the Hill District, we've gone in kind of, what kind of projects will make this area more livable, and real excited about, all the different small projects. And then there's been a lot of collective grief in neighborhoods. We've been thinking a lot about gun violence and issues that, they're the 8 domains of livability. They're the different factors you have on the livability index, but really listening and saying, what did we include about grief, for example, in our action plan? We actually do have a action item related to collective grief. And knowing that we can't tackle everything at once, we're very small. We're very small. We do have a large coalition, but I think making sure we bring the right partners together in the room, like you were saying, just trying to bring people together and make sure we're listening, and things are changing all the time, but trying to be as responsive as we can. I was just talking to a partner at the University of Pittsburgh School of Social Work. They're a fantastic supporting partner of the work that we do. And I didn't realize that she had a mental health background, and she was telling me all the ways that she has been supporting communities of color to talk more about mental health. And I was thinking, I gotta loop you in with the people that are working on some of this collective grief work. And so yeah, it's always kind of like a mixing and matching of priorities, and trying to think big, but also like what one of our neighbors said it really well. He said, how can we're thinking about hitting singles, right? Like, you're not gonna hit a home run all the time or do something that's gonna, maybe at your level you are, but at the more local level, thinking about how can we hit singles together.
Well, as a Nationals fan, I wish they could hit more singles, but I'll leave that alone.
It works.
I just want any kind of hit.
Well, next year.
I'm scared of that too. But speaking of the Nationals, the DC region, Stuart, prioritization here, is that as complex as it may seem?
Well, certainly, and we're 6 staff working across, there's 22 jurisdictions in the Council of Governments region. We can't work all of those. We're working about a dozen, maybe. Yeah, my staff will accuse me of not being very good at prioritization, of course, because I try to do everything. But I think, if you think about smart growth and what has been our core agenda for years, it's been housing and transportation and transit-oriented communities and safe streets, pretty much. And you notice I didn't mention the environment. We have a wonderful set of environmental and conservation partners, and we think by working on smart growth and efficient development patterns, we're addressing many factors in the environment. I would say, I've mentioned it from the very beginning, housing is probably our #1 priority in terms of housing policy, location of housing, supporting good projects and plans. Transit, the second priority of these because of the crisis we're having in transit funding right now. But we don't leave aside the fact that for each transit-oriented plan and project comes forward, it's going to need our support. There's always opponents to it. And again, we try to make sure these are inclusive. And to some extent, we're doing safe streets work. We have great advocates in Families for Safe Streets and the bicycle advocates, but we focused a lot on the arterials. Now, if I had to give another piece of it is, while we are still doing work in DC, there are a number of other great DC partners. We feel like we really have to help the suburbs fix the suburbs. We will not have sustainable regional growth and accessibility and healthy communities for all ages unless we can make the suburbs more livable, more walkable, more inclusive and accessible, and not just dependent upon the automobile. And so that is one of the greatest challenges we face. And I have to say, in terms of one negative note, I very much worry that the pandemic and the telecommuting, for all its convenience, is increasing our segregation. It's increasing our outward spread, dependence on the automobile, and that we're becoming more segregated economically and racially even because of this convenience of telecommuting. And so encouraging people to understand the benefits of coming together in community, in mixed income, mixed age communities is going to be a really important challenge ahead in terms of what we're doing.
That's interesting. You know, early in the pandemic, I think there was, at least in my Twitter feed, there seemed to be a lot of discussion about walkability being such an important thing. People walking around more, they're exploring their neighborhoods more, they're on the running trails or walking to wherever they were getting things done. It's interesting that you're seeing some of these challenges out of it. I'm curious if our other panelists think COVID has had an impact one way or the other on the work that you're doing.
I think, is it okay if I go? We helped out a lot with the vaccine clinics. And early on, you'll recall that people 65 and older were allowed to get their shots before everyone else, which was awesome. Sign-ups were online, which was not awesome. I keep coming, I mean, COVID taught us so much. But I returned to the, just thinking about those early clinics and just how important it is to work with our healthcare providers, another partner that you have to have in this. And we do, thinking about age-friendly health systems, which is a different framework than the communities one, but is so important to be thinking about together. But then digital access, which was brought up earlier, we're really thinking, you know, the world is in person and it's also online. And how can everyone just have access to that, have access to digital literacy opportunities, just bringing everybody along so that we speak the same language. And at the same time, reminding people that if you're gonna do an event and you're gonna have registration, don't just have registration online, have there be a phone number to call if you really wanna be as inclusive as possible. Yeah, I always think about those vaccine clinics.
You have PTSD?
Oh, I can tell you a story, a line that went all the way. I think everybody can probably tell you a story, but.
I think from both of my hats, I think COVID taught a lot. I think as somebody who works in permanent supportive housing, and I don't work on the transitional housing, but did a lot of work with that when I started my new job, we learned how quickly we can do something, which isn't always the case with governments. And so we had to, you know, really get people out of shelters and create non-congregate settings. So we had to get creative on how we housed people. And I think those are models that I'm starting to see move forward when we start thinking about adaptive reuse. I mean, we just had the Biden release this week talking about, you know, converting vacant commercial stuff to housing. So I think those are all things we already knew we could do, but we just weren't doing them. And now there's a need. I do think there is something to be said about gathering in person. But one of the things, as somebody who goes to public meetings a lot, you know, the hybrid notion, I mean, we saw more people participating in hearings despite, you know, the digital divide in this country. We did see a lot of people participating in meetings that wouldn't otherwise have attended because our meetings are during the day and in downtown. So that is an impediment and barrier for some people participating, but people could call in and people could sit on Zoom all 14 hours with the rest of us if they were particularly interested. And I will say, there's not very much I'm that interested in being in person for, but I can sit on my couch and listen in. So I think it did teach us a different way of engaging community, and some of the models we've been using since zoning started probably need to be updated on how we do that.
Yep, you know, we measure internet access in the index, right? The idea that you have to have high-speed internet, and we actually also look at how many providers there are, so it's competition to keep prices reasonable as well. And one of the things that's excited me in some of the things some of the data our research team has looked at is how much internet usage and familiarity went up amongst the older adult population during the pandemic. So it's very tough at the beginning for a lot of folks, but you know, a lot of folks are online now, and so if we can get the high-speed internet access to folks, if they can be connected in a different way, they can be part of your town hall meeting or whatever zoning conversation might be, and everything else, connect with their family, connect with their healthcare provider, whatever it might be, that are connections there that are really important for folks. That's wonderful to see.
Yeah, my dad has learned how to use Facebook, which is scary, but it's also been helpful because when he's talking to his doctors, he actually has tele-appointments now, and I don't live in Seattle where he is, and he figured out how to do it himself, so it's really exciting because it was very, very stressful in the beginning.
Yeah, I mean, it's you know, we talk about social connection and people the online is increasingly important, and there's also kind of the in-person. And I think to your point, or to someone's point about the hybrid nature of, I think society is hybrid now, right? The idea that we need to figure out ways to connect with each other and the efficiencies of doing things online and also in person. And we try to capture a lot of that with the index as we do that work as well. One thing that came up in that cross conversation a little bit ago was the idea of the complexity of people, that people have a lot of different elements to them. And one of the things I know that we're starting to talk a little bit now is about the more social side. We've talked about housing and transportation a lot. But Laura, I want to talk to you about strengthening livability through a social lens, because it's different than that work that we have to do to work infrastructure and investment. So could you give thoughts on how groups can approach this aspect of the livability paradigm?
Well, there's so many different ways. One that's at the top of my mind, and I'm not talking social as, go to a senior center, although amazing opportunities at senior centers and community centers, even better, that invite all generations in. But one thing that has come up in Pittsburgh a lot are job opportunities for older adults, for people of all ages. And that's on the social side. It's not the physical infrastructure, but we need to make sure that there are job opportunities and job training, because older people want to work, need to work, combination of the two. And so, we did our own survey back in 2021 when we were developing our action plan. And among people who were still in the workforce, 67% said that they wanted to work, or they planned to work as long as possible. And in the Pittsburgh area, we have the one segment of the workforce that is growing is our older adult population. And we don't have employers thinking about that. Like, that's we're all looking for great staff members, and I think if we just expand our mind on who those candidates could be, and think about ways to reach them, ways to retain them in different ways, is so important. We're thinking a lot about ageism and the intersections between age and the workplace, and really trying to work with employers in the region, again, to see this older adult population as a growing asset that we have.
Yeah, and older adults as part of the population is, I think, a theme here, right? That older adults want job opportunities as younger folks do. Right. Older adults want to be near, have transportation options as younger folks do, want to be near things in their community as others do. I'm reminded, this is a survey before Angel started serving with APA, but we did some work together back a few years ago showing that older adults and younger populations all want these things similarly. And that's one of the things at the core of the index, the idea that we're not making an index just for older adults. The idea is that we're trying to create a way that we can have communities that work for all people of all ages, regardless of their income, regardless of where they are, regardless of their age, and these other factors. Other people have those things in common. At this point, I want to encourage the folks in the room to think about those questions and write them down if you've got them. I've got a few more, but I'd love to hear if anyone has questions that they want to ask any of our panelists as well. And another thing I want to talk about were communities of different sizes. Obviously, APA is the whole country. We've got different community sizes in each of your regions as well. Are there differences in the approach to improving livability for larger communities and smaller communities in your experiences?
Well,
Your turn.
I think about a county like Fairfax County or Montgomery County. These are very large counties. There are 1.1 million people in Fairfax County, and it's almost too big to get your hands around, your head around. It's so many different types of geographies and types of neighborhoods. So we've had to be more targeted to focus first on the metro stations, second on the aging commercial corridors that could be great places for mixed-use walkable conversion to those. And I guess the third place will be, as we're trying to think about a livable community, is we do have single-family neighborhoods where people are dependent on driving everywhere, but there are some shopping centers that might be reasonably nearby, but just adding a trail, a paved trail that would help a senior from their home to that shopping center or to that library that might be in the neighborhood that they couldn't otherwise get to. So we're trying to intervene even in a place like that. But it was very clear in your index, the smaller the community, the more compact, the older it was in terms of its, when it was built, pre-World War II ideally, would have a grid of streets and connectivity. The other one's doing better. It's the big post-World War II sprawling suburbs which are the hardest to adjust and fix. I was going to add one other thing to this that I think is important. I learned it from we've got a great new urbanist in the audience here, Peter Katz, but I remember Andres Dwani talking about the monoculture, the mono-age we've gotten in our communities, speaking of the builders. Build a single-family home neighborhood, all the young families move in, they raise their kids, they might age in place, in that place, and then the next neighborhood now out has the young families with the kids, then the next neighborhood, and we close the schools in the old neighborhoods because we don't have any kids in them. So it's an argument for why we need diverse ages and diverse housing types in each neighborhood. And I'm fortunate enough to live in a city row house neighborhood that has that diversity of single row houses, owner occupied, some duplexes, some 8-unit apartment buildings, all mixed in with a range of ages. And I think people look out for each other there. The younger folks start looking out for the older folks within that same neighborhood. So it works.
Yeah, multi-generational communities are so important. I know we've got friends from some Generations United and some of the other organizations in the crowd that are working on multi-generational communities, and that's a crucial piece. Circling back to the small communities point that you're making, Stuart, we've talked a lot about urban and suburban communities, but to your very point, when you look at our top communities list and you look at the index in general, a lot of, in rural spaces, being close to town, being close to that center of town, you may have all of these benefits of a livable community. It's not just an urban or suburban phenomenon. But I don't know if either of the other panels want to talk about the size of communities and how that impacts the work that you do.
I think, excuse me, I think in terms of scale, I think the issues are very similar, but the scale of which it's done is certainly going to be a little different. Obviously, I live in Chicago, so transit is very big. My parents are both from rural southern towns, so it's not going to be a train, it's going to be increased buses. I think what you were talking about, Stuart, about trails, there's a trail in my mom's rural town going in, which it's way too hot to be walking, but whatever. But it will help with people being able to get around because there's not a lot of sidewalks, and I'm noticing more and more new developments that are coming up are starting to include sidewalks. So for those who are willing to be out in the heat in the summer, but in the winter when I go, I can actually go walking, which is not something I was able to do growing up, which is changing. It's a game changer for those communities, not even just from a livability aspect, but also a health aspect, because during COVID, where I live, parks weren't necessarily open, so you were walking on the streets a little bit more, and that wasn't a luxury they had there, and they now do. And so, my great aunt's walking now, which is amazing from a health factor, because housing sometimes is a social determinant of health, and so it is increasing that. So I think we just have to think the issues are the same, suburban, urban, and or rural. It's just the scale in which you do them and what they might look like is a little bit different, and being clear on that.
Yeah. And I think totally, and I think at least from my perspective, we've worked like at countywide for the first 5 years of being part of this network. We just kind of worked countywide as best we could, and then now working in these 3 targeting areas, working in 3 distinct neighborhoods. In both of those, we did what we call Aging Your Way workshops. So we went really small. Even if you're in a big, you're really thinking about the whole county, it's like, how can we come together in a library? And we bring people together, people of all ages, and say, what is it that you need in your community to live here as long as possible? And have them really dream together and come up with projects together, thinking about all the assets that they have in their community, whether it's very small or very big. And so I think a theme of our work is really trying to listen and go to people where they are, meet them, and understand them as the best experts that we really have. And I think the Livability Index is great because you can go in and say, here's what we heard from the data. What's your experience? It's like a really great jumping off point to spark conversation.
That's great. That's great. Before we get to questions, I want to just tag on a couple of things that Angela mentioned quickly to note. First, the regional issues that parts of the country can be different as well. And I think we've got all of our different panelists representing different parts of the country, and you can see some of the commonalities. But I know that there's we need to know and understand each community before we're working in them. And you mentioned weather. One of the things we've added to the index on popular demand is weather. You can now find climate information in the index this year, starting today, which we've managed to put in there because not everybody wants a warm climate, not everybody wants a cold climate. You want something in between. So you're now able to offer that to folks. And walkability, you mentioned as well. We've got a new walkability index. The EPA released an index we've been able to incorporate to have a better grasp on walkability. So lots of changes I couldn't squeeze in when I was up at the podium earlier. Happy to talk about those. I see Brittany at the back, and she looks like she's chomping at the bit with some great questions from the audience. So I'll ask her to ask us something good. What do you have for us, Brittany?
We're good now. Okay. All right. Producing such a comprehensive index is a monumental undertaking. How do you envision communities putting it to use, both in terms of building support as well as for focusing action around certain aspects of a place?
Well, I guess I'll answer that first and say that it does take a lot of work to put an index together like this. I didn't have gray hair when I started this. But we hope communities use this in a couple of ways. We hope that they're using it. Communities that don't have planning departments, that don't have the great planners that Angela is, could use our data themselves to understand their communities. Others might use it to support the work that they're doing. And regular folks can use it too. I was the first user of the index. Even before it was finished, I brought one of the prototypes to one of our meetings in Prince George's County, Maryland, where I said, there's about building a regional health center and whether that should come to the neighborhood where I lived. I said, well, from the index at that point, we had a 0% patient satisfaction rate for people in this neighborhood. We need to do something about this. And so I could do that, but anyone else could do that too with the information that we share there. I think that's my take on it. I don't know if anyone else wanted to add to that one, but.
I would just say, in my life as a real estate developer, it's definitely usable in that we have to tell a story when we're looking for our permits. And most of the things in the Livability Index are things that commissioners and or elected officials care about, and why my wonderful affordable housing development should be going in their nice upscale community. But it gave data to really back up a decision on why it would be a great opportunity for affordable housing.
I can see us using it when we're selecting the new neighborhoods that we want to be in. I can also see us referring our community partners to it as they write grants and make a case for why their work is important. We haven't really talked about that, but you need access to data, and it is a really easy way to get to a lot of different data points that otherwise you're just kind of hunting around to find. So it's in one spot. Yeah, exactly.
And we'll encourage our localities to use it, and our council of governments, the regional council of governments. I think it's a great tool that they could use.
Great.
And then shifting focus from the high-performing communities to lower-performing communities. How can we effectively convey the livability index data to both residents and elected officials in communities with lower livability scores?
Well, that's a good one.
Well, I'm going to call my cousins in the Delta of Arkansas and share the index with them. And one of my cousins is a doctor who's been working his whole career in trying to improve health outcomes there. I noticed that they had an absolutely terrible score, as much of the Delta does on the health score. But they also had some other decent scores because they actually have a town there that's still surviving. So we should all reach out to any of our cousins who are in more rural parts of the country and share the tool with them.
Well, you'll see an article on AARP.org if you go there about the top 10 communities. We've got our top 100. People like the top. People like to think about the top. But when I go to talk to communities that have challenges, what I like to point out is this index also shows what's going well here. So you might be an industrial town with lots of challenges, but here's what's going on well in the community. Here's something we can build on. And I often remark about how sometimes the high-income, isolated suburban community will score kind of middling to low on our index because they've got all the challenges they've got there. They've got affordability. They're far away from things. Well, on the other hand, an urban community might score the same score that has challenges. Maybe they have crime issues or some other challenges, but then they've got great infrastructure to build on. They've got housing choice and a lot of range there and a spirit of community as well. And so every community's got things they can build on, and I think that's a place to start from, and every community has those challenges we talked about too. So I think we can use this kind of conversation in every community. I think it's really important to have. Got another one for us?
From the perspective of the broader housing market, aging in place is not without its drawbacks. While it may be great for people who are aging to maintain their social and community connections, it limits the availability of units for younger and often larger households. How do we think about reconciling this tension?
Oh, interesting, the generational tension.
That's one of the reasons I think having a more diverse housing stock would be great. Having the missing middle, having single-level living flats and things like that people could downsize to would be great. I think one of our challenges in the DC region, we don't have enough of those places, and so those are not that much of a savings for someone who sells their primary home they've lived in for a long time. But I think that would make a difference. You could still live in your community if you had those options nearby, and you would then free up that single-family home for the next family to raise their kids.
Yeah, one of the things that I always say is we're dealing with a small source to begin with. We don't have enough housing options to begin with. So some of these tensions, I think, just come out of the scarcity that's there. And so we certainly need more options all over. And that makes things easier and doesn't have, there's not inherently necessarily a tension between generations. It's that when we don't have enough housing that works or housing that's affordable, then that's when we see some of those tensions start to come.
Another great segue. How can we get builders and contractors to better understand the particular needs of seniors and disabled individuals as they age in place?
Sounds like one for you, Laura.
Yeah, tell me, because I'm going to be talking to them. I think everybody does have a personal story related to this, whether you see that as your parent, your grandparent, or you see it as yourself. How many of you, earlier I said how old I am. Did anybody hear? Well, how old am I? 40, good. Ears perk up when you talk about aging, right? We often don't share it, it's kind of taboo, but I think, we have to, builders are people who live in the world, and I think trying to explain that if you think about it from a universal design standpoint, if you create things that are good for older adults, people with disabilities, that's going to be better for everyone. That's what I'm going to try to hit home. And the fact that aging in place is not just in your house, it's in your community. What else should I say to them? You tell me.
No, I was just kind of thinking, the data in this actually tells the story about why you would create, particularly people who are developing whole communities at a time, why diversity of housing is important from a business perspective, because people are starting to look for neighborhoods where they can, in fact, stay. Like, I'm from Seattle. I can't afford to live there under any circumstance, so that would not be somewhere I would consider moving back, because I can't afford it now and I'm not going to be able to afford it later, because there aren't there might be, but the ship has sailed there. But having options in the community, because you do get my dad will not move. He loves his neighborhood, and I can't find anything he could remotely afford anywhere near it. So those are the types of things. It's market, it's money. There is a business case for doing it. So I think showing the data and then showing the trends on how people are starting to decide where they live is changing to think about that. Particularly people in our age group.
Well, and the other thing I'd say, honestly, is that point to the builders in the room that are doing it. I won't give anyone a free advertisement now, but there are some that are really seeing this market. They're understanding the diversity within the market, and they're building the product for folks. And to me, it's just a matter of more doing that, more understanding it, and more doing the kinds of building that we need. So I'd like to encourage those that are doing it and doing it well.
Storytelling.
Storytelling is always a good thing. All right, do we have one more in the back of the room, or? I think we do.
With respect to the conversations on livability, what aspects of communities are missing that people should know about? For example, Laura mentioned grief, and Deputy Secretary Todman mentioned disaster relief.
That's great. Although I will mention we do have natural hazard mitigation plans in the index, but what's missing with the conversation, or what should we be able to measure? And I will say one of the big limitations of building an index like this is the idea that we want to build it for every neighborhood, every community. So we can't find measures that are measured in every neighborhood, every community across the country. There are many things. We started with over 300 potential indicators. We started this thing. We whittled it down to 61 in part for that reason. So there's lots of things that are important that we can't measure. One, I'll give my example, is I always wanted to measure sidewalk quality. Because if you can't walk in a neighborhood, it may not have sidewalks at all, but there's no national sidewalk database to use. So with all that preamble, are there things you wish we could measure in an index like this and add to the list of things we have?
I mean, I think there are so many intangibles, right? Like in Pittsburgh, there are people who have lived in Pittsburgh for generations. So when you talk to them, you can't, like, you couldn't include it in the index, like their lived experience, like you said. One thing that we asked people in our survey is, do you have someone that you can count on day or night? And interestingly, in Pittsburgh, in the region, 93% of people said yes. Mm-hmm. And our area agency on aging was like, wait, what? Like, I don't think that's right. And we said, that's what we heard. And so when we went to the community, again, having data as a jumping off point to spark conversation, we said, we heard that 93% of you said you had somebody to call day or night. That's amazing. Do you think that's true? I don't know. I don't think you could get like that data point across the country, but I just think there are some, that's when you get into the storytelling. That's when you get into, those feelings, the Mr. Roger feelings of your neighborhood, and that doesn't maybe come up, but it can in conversation.
Fair enough. Anything else on the wish list? I'll put out a wish list item too, and if we lost the HUD secretary, I really wish we had more information on homelessness issues. That's a big challenge. It's in Seattle, it's in San Francisco, it's in many of the other communities we talk about. And again, it's hard to measure on that national level, so we just can't, we have to approximate and figure out how to think about it. But there have been some great studies, one in California done recently, to talk about and understand where people are coming from and all that. So that's one other thing I wish we did have.
Well, since you brought it up, I would also piggyback on, as someone who works in homelessness a lot, how we define homelessness for HUD versus how agencies and advocacy organizations do it is always going to be a mismatch. For instance, the point-in-time count in Chicago came in at around 5,000, but the Chicago Coalition for Homeless would say we're at about 68,000. Wow. Because of how we define it. So you'll look at the Department of Education definition is a much more efficient definition of homelessness than how HUD does it. So if I had to just do a plug, go with that definition if you're getting a measure.
All right, that's your wish list. So we're almost out of time for this first panel. So speaking of wish list items, I want to ask this final question, which is your wish list for a community change. Like if you could change something, we lost the HUD secretary, deputy secretary, but at the national level, or if you could wave a magic wand, what would you change about communities, either at that national level or at the local level? We've heard one thing from Angela. She may have another, or our other panelists. What's your wish list item? Your king or queen for a day?
Mine is really simple, and I think we alluded to it earlier. I think that a community where anyone can live and afford to thrive. It's that simple for me.
That's a good wish. Laura?
Can I also be that might be my answer? We're thinking a lot about ageism and how how much we internalize ageism. It really impacts our health, and of course there are so many big problems in our world right now that I wish I could change, but I guess a realistic one that we're working on that I'm dedicated to is to countering ageism.
I'll give you one policy one at a federal level, which is shifting dollars from the highway program to housing. And I think one that is more social, which is we seem to have so much separating us and so many things, whether it's our time we spend in our cars or watching TV or whatever, or how far we spread it. I'd like to find ways that we can all come together more within communities. Maybe I'm a nostalgia buff here, but in my own neighborhood, I'm very lucky to have a neighborhood that comes together on a lot of things. And I think that's going to be key for so many things, whether it's taking care of people who are aging, to knitting our society back together. So that's why I'm biased to the physical nature of a walkable, mixed-income community.
Well, my wish is that more communities had a steward, Angela or Laura themselves. So would you join me in thanking our panelists? Great. So for those in person, we're going to take about a 15-minute networking break, and we'll come back with panel 2 in just a little bit. So thanks, everyone.